Hello again. I'm Dr. David Speers. I'm an infectious disease physician at Sir Charles Gairdner Hospital, but I'm also involved in the infection control aspects for the hospital at Sir Charles Gairdner Hospital and Osborne Park Hospital. A lot has happened in the last few days, so it is timely we have another update on some of the aspects of hospital life during this COVID response. First of all, many of you will have seen the nightly news broadcasts of what is happening in countries overseas, particularly in Europe. We need to be mindful that what's happening in Europe is a very different situation to what's happening here locally. The virus has spread widely in the communities of a number of European countries, and they are trying to control the spread of this virus in this current situation. This is very different to what's happening here, and also different to what's happening in other states of Australia, where we are not in a situation where there is widespread community transmission. This actually gives us an opportunity in time to put measures in place to have better control of the outbreak before it starts to spread widely amongst our people. So we need to think of ourselves as soldiers in an army in the war against COVID, and we all have our part to play. Your part is no less important than people who sit on pandemic committees and so forth for the hospital or for the state. We all have a very important role to play. We're going into the fight against this COVID virus without a vaccine and without a proven treatment. But that doesn't mean we don't have some weapons in our arsenal to fight against this virus. The important weapons that we have is the prevention of COVID to people around us and to ourselves. And we can do this in two ways. One is by creating physical distance between each other, and for the hospital, the use of PPE or personal protective equipment when, for the care of our patients, we have to come into close proximity with them. As we have greater understanding of the COVID infection itself, we're understanding the symptoms that it produces better. Only a small minority of people with COVID-19 actually have diarrhoea as a symptom, but it can be present. Another symptom that is emerging is the presence of loss of smell or taste in patients with acute disease and a significant degree of fatigue. So let's talk a little bit more about how the virus passes itself on from person to person. To become infected with the COVID virus, it has to come in contact with your respiratory tract, or what we call the mucosal lining of your respiratory system. It can only get to this site in one of two ways. It can travel in the air and you can inhale it, or it can deposit on surfaces and you can touch this with your hands and then touch your mouth or your nose or your eyes and transmit it to yourself that way. This is why the two main manoeuvres to prevent transmission of COVID is to physically space each other and to be diligent with our hand hygiene, because surfaces that are contaminated with COVID can only be picked up and transmitted to your respiratory tract through your hands. So hand hygiene, even for a virus like COVID, is critically important. So how does COVID virus transmit itself through the air? For people with mild illness who are walking around in our community and don't know that they have COVID, through coughing and sneezing, this creates what's called respiratory droplets. These are relatively large droplets of our respiratory secretions, and because they're large, they're subject to gravity and they actually deposit in close proximity around the person. So the metre or so around a person can be contaminated by settling of these respiratory droplets. This is why keeping a physical distance of 1.5 or 2 metres is so important, because you're not entering that zone of where these respiratory droplets may be. In the hospital situation, it is also the case that the majority of COVID patients can transmit the virus through droplet spread, and therefore hand hygiene again and physical distancing is critically important. This is why we have the chairs in waiting rooms in the COVID clinic deliberately spaced this distance. But as I mentioned before, healthcare workers do have to have close contact with patients who may have COVID or have been proven to have COVID. And this is where personal protective equipment, or PPE, is so important. The other fact about hospitalised patients is the ones who are critically unwell and the ones that are undergoing special procedures that may create aerosols, or what we call aerosol generating procedures, require special precautions for our staff and others. So there's a lot of talk about PPE in the hospital, and there's a lot of confusion as well. There is talk of PPE supplies running out. I can tell you that the state supply people are working around the clock to secure the PPE that we need, and currently we have the PPE available for our purposes. So what is the correct way to use PPE? There is actually a national committee that is providing the recommendations for the use of our PPE, and this is followed by all our hospitals as well as hospitals in other states. PPE needs to be conserved because we need to have sufficient PPE available in case we have a large winter epidemic of COVID, in which case there will be widespread community transmission. We can conserve our PPE in two ways. Firstly, we can make sure that the use of PPE is appropriate to the current situation, and also we can look at ways of reusing the PPE so we can extend the life of each individual item. So what you might find is our advice on the appropriate use of PPE changes over time, and this is because we're monitoring the situation both locally and in other parts of Australia and overseas, so that we provide the most timely advice for the use of PPE. I appreciate that the guidelines for the response to COVID are changing rapidly, and I know it causes confusion and it's hard to keep up, but please try and review the most updated guidelines that you have available, which are present on the hospital website. Bear in mind that with the changes in PPE recommendations, we always have the safety of our staff in mind, and we will not put our staff at unnecessary risk just to conserve PPE. So if we all do our bit by complying with the social distancing recommendations and the appropriate use of our personal protective equipment, we'll be doing the best job we can to preserve the welfare not only of our patients but also of our friends, colleagues and other staff members. Remember, we're in a very different situation to that in other countries such as in Europe. We have this opportunity in time to have a much more greater impact on the spread of this COVID virus before it becomes widespread in our community, which will lead to the best outcome for everyone in this state. So I'll now move on to some more specific questions about the use of PPE in the hospital. The first one is whether people should be walking around the hospital wearing masks. This is not the case. This causes alarm to our visitors and our patients, and it is also an inappropriate use of the PPE, which currently should only be worn under specific circumstances as outlined in our COVID response guidelines. The use of masks all day during normal hospital practice is actually doing a disservice to the hospital, because we need to be conserving our PPE for the most appropriate uses. The next question is it okay to bring your own PPE to work? Well, in fact, this is not appropriate. The PPE that is provided by the hospital has undergone rigorous assessment and quality checks and is known to be safe to both patients and staff. If people bring in their own PPE, we have no idea as to the quality, and it may be putting yourself or your patients at risk. So it's important that only approved PPE is used in the hospital. There's also some confusion over when to wear an N95 mask and when to wear a surgical mask. Basically, for the care of most COVID patients, these are under droplet precautions and therefore a surgical mask is appropriate. There are only certain circumstances where an N95 mask is recommended, and these are used for patients who are critically unwell, because we know patients with more severe disease excrete larger amounts of virus, but also when specific procedures are being performed in the hospital where it can convert droplets into aerosols. Common examples of these are bronchoscopies and intubation, and also non-invasive ventilation. So when wearing an N95 mask, it's important that you perform a fit check each time you put the mask on your face. It is not necessary to undergo formal fit testing, which is a procedure done with a special machine. It's inevitable that some breaches in PPE will occur, and it's important that you report these to your manager so that the appropriate follow-up can be organised. Not all breaches will result in you being placed on home isolation. Only if you're considered a close contact with more extensive exposure to an infectious COVID patient, such as sharing the same airspace for 2 hours or close contact for at least half an hour, you may be asked to go on home isolation. I know home isolation might be difficult, particularly when you're feeling very well and you know that everyone is working so hard in the hospital, but it is better that you play your part by staying away from the hospital, because we don't want you passing on the COVID virus should you become symptomatic from your breach in PPE. Therefore, you're doing your part as much as anyone by staying away from the hospital until you are cleared to return to work. So it's important that we explore avenues of how we can conserve our PPE. We can do this in one of two ways. We can have PPE that is reused, and a good example of this is eyewear such as goggles and face visors. Shortly, a guideline will be published which will give you instructions on how we can reuse PPE and also extend the use of some PPE. PPE that is able to be disinfected, such as eyewear, there will be guidelines as to how to disinfect these items and reuse them. Face visors will be dedicated to individual staff members. Masks being made of porous material cannot be disinfected, and therefore we will conserve masks by extending the use of them. It's important that with all PPE, particularly when we request you use them for extended periods, that you refrain from touching or manipulating the PPE, because this can turn the PPE into contaminated surfaces which may increase the spread of the COVID virus. So wear the PPE correctly and try and avoid touching it at all times. If the PPE becomes wet or soiled or damaged, you must replace the PPE. PPE can be used continuously during episodes of patient care, but if you go on a comfort or meal break, it will be required that the PPE is changed. If you leave an area such as a COVID cohort ward, you will also be asked to change your PPE when you leave that ward. There are also a lot of questions about what to wear to work. The PPE, of course, is designed to protect your clothing, but the hospital has a dress code which we ask you to comply with, and it is recommended that you launder your clothes each day after work. The normal laundering process of your washing machine will kill off any virus that could be on these surfaces. Also, people working around the hospital, such as plumbers working on sewers or drains, you need to be aware that the COVID virus may be excreted in the stools of patients, and therefore these tools should be cleaned after each episode of working on a sewer or a drain. What about cleaning a room after a COVID patient has been discharged? COVID patients who are critically unwell or undergoing aerosol generating procedures will be in a negative pressure room. These rooms are specially designed to keep the air in the room separate from the rest of the hospital. The air exchanges in these rooms happen at a much faster rate than normal, and therefore the infected air is evacuated very promptly. Cleaning can occur in a negative pressure room 30 minutes after the patient has been discharged. This gives a large margin of error for any residual virus that may be in the air. Because there is no longer any virus in the air, it is really a matter of protecting yourself from surfaces when you clean these rooms, and therefore there is no need to wear hairnets or other PPE over and above the gowns and gloves that have been recommended. In terms of the linen from a patient's room after they have been discharged after COVID infection, these can be placed in the special bags which can be sealed and transferred to the laundry. These bags do not need to be opened because they dissolve once they're placed into the washing machines, so no one needs to come in contact with the soiled linen.